The governor also wants to address a shortage of healthcare workers. The Georgia Hospital Association reports there's a rising demand for these jobs. More than 20% of the workforce, like registered nurses, physicians, and clinical techs, are likely to retire in the next decade. But colleges like Mercer University are actively working to tackle the shortage. And that's where we find Camila Williams.
Yeah, good evening, Lori. At the Georgia Chamber of Commerce Ags and Issues breakfast this morning, Governor Brian Kemp unveiled his $2 billion spending project. Now, it would include a separate medical school at the University of Georgia and a new dental school at the Georgia Southern University. Now, that bill also, it would include many great benefits. So I talked with the Dean of Mercer School of Medicine and nurses about why there is a need for healthcare workers in the Peach State. Jennifer Davis is a registered nurse at Piedmont-Macon. She says nursing is a passion.
I got into nursing, I think, why everyone gets into nursing. I know it's a cliche statement, but we really just want to help people.
Her favorite part is meeting new patients and helping them get better. Davis says that's why healthcare workers are important.
We could never do it alone. We have to have multiple hands in there. I could never do it alone with one person.
And being a nurse or a doctor requires extensive training. Mercer School of Medicine Dean Gene Sumner says having different initiatives to help students excel is how they are helping reduce the current healthcare shortage.
We only accept Georgians, and we preferentially accept young people who care about our mission and who maybe come from rural Georgia.
According to the Georgia Chamber of Commerce, by 2030, Georgia will need over 100,000 healthcare workers. But in rural Georgia, Sumner says
there are counties in Georgia that have no doctors, and there are counties, one of the counties we put a clinic in had no doctor to 36,000 people.
Stephanie Roseborough with Piedmont-Macon says adding another medical school will help more students see what the day-to-day job is like.
Having more people coming through here doing their rotations and clinicals is going to give them a better idea of, what a great community this is and also what the need is.
And the hope that those young doctors stay.
The bottom line probably would really just be to recognize, respect, and then safe ratios, safe staffing, safe abilities in the hospital.
Now, the University of Georgia President Jerry Moorhead did send me a statement saying, quote, "We appreciate the governor's announcement of his support for a new medical school at the University of Georgia, and we'll look forward to working with the Chancellor and Board of Regents, as well as the General Assembly, to advance this exciting initiative." Live in Macon, Camila Williams, 13 WMAZ News.
Thank you, Camila. The legislature must first approve Governor Kemp's spending bill before the money is given to the schools. There's still some concern among lawmakers that the state's revenue is slowing down.